issues that we just had to quickly respond to, but we're back on track now. So just when we start, I'd just like to double check that everyone can see and hear us okay. So on the bottom left-hand side of your screen, there's a chat box. So if you can see and hear us okay, can you just type a little message to let us know that you're there and that you can see us okay? Excellent. So we're getting all thumbs up, Kathy, which is marvellous.
Good.
Excellent. Excellent. So my name is Sally Morris. I'm the National Mind Out Project Coordinator with the National LGBTI Health Alliance. Before we start our webinars, we like to acknowledge the traditional owners on the land in which we're gathering, wherever that is across Australia. I'm actually based in Brisbane, so I'm on Turrbal and Jagera land. And Kathy actually is in Melbourne.
Yes, and so I am on Wurundjeri land, the Kulin Nation.
Awesome. Thank you, Kathy. We also, when we start our webinars, we've also a bit of a tradition of also acknowledging our LGBTI elders who've gone before us and actually have paved the way for us to be able to be here today speaking about topics around LGBTI people and communities. So today we have Kathy, who's going to be talking about considerations when providing mental health first aid to an LGBTIQ person. I'm really excited about today's webinar because actually this is a project that Mind Out was intimately involved with throughout the development, and it's quite exciting to see the end product. So Kathy's going to go through and talk about what this resource is and how it came to be and how it might be of use to you in your work. So just today's webinar is interactive. So if you do have any questions for Kathy throughout today's webinar, please just type a little message in the chat box on your lower left-hand side of your screen. Kathy, depending on how she goes, might answer some of those questions throughout the webinar, or she might wait until the end to respond to them. But if you have a thought you want to get down, please feel free to do that. Okay, Kathy, so I'm going to hand over to you.
Great, thank you. Yeah, this is the first time I've done a webinar, so I'm likely to wait and do the questions at the end. I'm not so sure I can read and think and talk all at the same time, so we'll see how we go. So first of all, I'd just like to thank Sally and Mind Out for having me come to speak on these guidelines that we developed about what you need to consider when providing mental health first aid to an LGBTIQ person. Okay, there we go. So today I'm going to begin by defining some of the terms that we use in the guidelines. Then I'm going to do a brief literature review of mental health problems in LGBTIQ people. And then I'm going to talk a little bit about the research that we use to develop the guidelines. And finally then share some of what is actually in the guidelines. I keep hitting the wrong button to advance the slides. So first of all, I'd like to acknowledge that language and terminology is extremely important and that it changes over time and can vary depending on your location and your culture. When we started to think about these guidelines and develop them, we spent quite a significant amount of time talking about the terms that we would use. We consulted with Sally and others from Mind Out and the LGBTI Health Alliance. And so with this in mind, I acknowledge that I may use some terms that you don't use or that aren't used in your area or community. So to begin with, LGBTIQ traditionally stands for lesbian, gay, bisexual, transgender, intersex, and questioning or queer. In these guidelines, we've expanded this to also include all sexual and romantic attractions, so that may be asexual, pansexual, etc., and all gender identities. So the term transgender is often used differently depending on the context. In these guidelines, it's a broad term for people whose gender identity, expression, or behavior is different from those typically associated with their assigned sex at birth. Intersex variation is an umbrella term used for people with physical characteristics that are seen as different from what is typically thought of as female or male bodies. These characteristics are present at birth and may become more noticeable during physical development. Intersex is distinct from sexuality and gender identity. So intersex people may identify as male, female, or another gender, and as gay, lesbian, bisexual, heterosexual, etc. Questioning refers to someone who's exploring their sexuality or gender identity. And queer is an umbrella term used by some people who are sexual or gender minorities. The other terms that I'll use that you may not be familiar with are LGBTIQ experience, and we use this to refer to the way an LGBTIQ person experiences sexual or romantic attraction, sexual behaviors, gender identity, or intersex variation. And cisgender, which refers to people whose gender identity is typically associated with their biological sex at birth. So now we're going to look at some of the Australian research around LGBTIQ people and mental health problems. I have a reference list that I put together in a PDF. I might type in my email address now, and then I'll also try to remember to give it to you at the end, and you're more than welcome to contact me for it. And then also when Sally uploads this to their website, the webcast, she'll also upload the PDF of the references. So the stats on this slide are from the Australian National Survey of Mental Health and Wellbeing. And this study found that the 12-month prevalence for mood, anxiety, and substance use disorders in LGBT people were higher as compared to the general population. There's less robust research investigating mental health problems in transgender people, but the research indicates that transgender people are 4 times more likely to ever have been diagnosed with depression and 1.5 times more likely to have an anxiety disorder. And then the methodology and results from research investigating mental health problems in people with an intersex variation vary greatly from study to study, making it really difficult to come to any solid conclusions. However, there is some indication that psychological distress has a significant impact on this population. And then, sorry, I'm just seeing that there might be some problems with the slides. Sally, I'm just wondering if you can let me know if people are having problems with the slides. I might wait just a minute because I don't want people to miss out. Oh, all good. Okay. Okay, PDF is going out. Okay, great. So we're currently on slide 8, and I might try to remember to say every once in a while what slide number we're on so that people can keep up. So looking at suicidal thoughts, again, the research is scant, but the methodology makes it difficult to compare to the general population, but certainly suicidal thoughts seem to be high in LGBTIQ people. So I want to be clear that LGBTIQ experiences do not in themselves cause mental health problems, but rather they may be associated with specific stressors. So this could be being part of a minority group, experiencing discrimination, prejudice, or abuse, and actual or anticipated insensitive treatment or violence. So there have been 2 longitudinal studies of LGBTIQ young people, and they found a positive relationship between victimization, which is threats, insults, and abuse, and poor mental health outcomes. But if good social supports are in place, these poor outcomes actually improved. So If we can provide sensitive and appropriate support to an LGBTIQ person, mental health outcomes will hopefully improve. But being able to do this does take specific knowledge and skills. And so over the years, Mental Health First Aid has been contacted about, providing or developing a specific LGBTIQ course. And after some discussion, we kind of felt like an entirely different course wasn't needed, but that perhaps we just needed to develop some guidelines to be used in conjunction with the course. So the guidelines in themselves are not going to tell you how to provide mental health first aid, but rather provide additional considerations. So they should be used in conjunction with our other guidelines or the mental health first aid course. And I'll kind of tell you a bit later how you can find these guidelines. So for those of you who aren't aware of what mental health first aid is, I'll just take a minute or two to tell you about it. So mental health first aid is the help offered to a person developing a mental health problem, experiencing a worsening of an existing mental health problem, or in a mental health crisis. And the first aid is given until appropriate professional help is received or until the crisis resolves. So the mental health first aid course was developed in 2000 by Betty Kitchener and Professor Tony Jorn. And our organization is a nonprofit organization focused on mental health training and research. Our vision is a community where everyone has the first aid skills to support people with mental health problems. And our mission is to provide high quality evidence-based mental health first aid education to everyone. And as you can see on this slide, we've had quite significant reach since its inception about 17 years ago. So we're currently in more than 20 overseas countries. Our instructors run about 3,000 courses a year here in Australia. And in 2015, we estimated that more than 1 million people worldwide have been trained in mental health first aid. And we estimate that mid this year, that will reach 2 million. Like physical first aid has doctors A, B, C, D, mental health first aid also has an action plan called ALGE, and that stands for Approach, Assess, and Assist with Any Crises, Listen and Communicate Non-Judgmentally, Give Support and Information, Encourage Appropriate Professional Help, and Encourage Other Supports. And this is kind of where mental health first aid fits in the illness recovery spectrum. We're kind of early intervention, a little bit of prevention on into when someone is first heading into treatment for their mental health problems. And an important aspect to our course is that it's evidence-based. So course curriculum is based on research, which I'll explain shortly, and the course itself has been rigorously evaluated and found to be effective in reducing stigma, increasing supportive behaviors, and increasing confidence in helping someone experiencing mental health problems. So the basis of our course is based on these guidelines that were developed using the Delphi research method. And the Delphi research method basically begins with a really broad search of the literature. So we look at websites, training materials, books, and academic literature, and then pull out of this literature any helping statements that are in there. And we put them into a survey, and we ask a group of experts to tell us whether or not they think that that particular helping statement needs to go in these mental health first aid guidelines. So for this particular study, if 90% of the experts said that a statement should go into the guidelines, then it went into the guidelines. For this particular study, our experts were 75 people from Australia, Ireland, New Zealand, the UK, and the USA, and they were all mental health professionals, educators, or support workers who work with LGBTIQ people or are a member of the LGBTIQ community or a close family member of someone from the LGBTIQ community. Okay, Okay, so now I'm going to go on to some of the specifics of the guidelines. What I want to say is that the guidelines are for mental health first aiders, not so much for mental health professionals, although a mental health professional who is not familiar with the LGBTIQ community might find these guidelines helpful. And so in sharing these with you, I know in a sense we're sort of preaching to the converted, but Sally and I thought it would be important that you're familiar with this resource so that you can refer other people on to them. So the key message of the guidelines include being mindful of the language that you use, avoid assumptions that can interfere with your ability to provide mental health first aid. The guidelines also outline some specific ways to support the person, including what to do if the person is experiencing distress due to discrimination or stigma, or about coming out, and what to do if the person is an adolescent. They also touch on ways to encourage help seeking for mental health problems. Now, I can't share every detail of the guidelines with you today, and so I'd encourage you to go to our website and download them and read them for yourself. And I'm going to, at the very end, share where you can find the guidelines on our website. So sexuality and gender lie on a spectrum rather than falling within rigid categories. So not everybody identifies as male or female. Furthermore, sexuality and gender identity may change over time. Also, an LGBTIQ person may hold a range of identities, for example, queer and transgender. So it's really important that you not make assumptions about their person's sexuality or gender identity based on the way they look, act, talk, dress, who their friends are, whether or not they have children. Don't make assumptions based on their about their sexuality based on their gender identity, or their gender identity based on their sexuality. And also don't make assumptions based on your own experiences, for example, if you're from the community. So it can be quite difficult for a person to disclose that they are LGBTIQ because of the language people use to ask questions, especially when language assumes heterosexuality and cisgendered experiences. So this is called heteronormativity, which is the unspoken assumption in society that all people are heterosexual and cisgendered. So this is things like asking a woman if she has a boyfriend or husband rather than do you have a partner, and things like when filling out a form when the only options are to tick that you're either male or female rather than having other options available. So by using appropriate and inclusive language, you can help the person to feel safe and comfortable about disclosing information that may be relevant to their distress. So things that you can do that might help are to use the same terms that they do, and the only exception to this is reclaimed language. And this is where a minority group has taken on the use of a word that has historically been used in a derogatory way. If you're unsure about the person's gender identity, trying to use non-gendered pronouns like they, them, their, or use their name. And if you're unsure about what terms to use, respectfully ask. One of the participants in the Delphi study actually commented about how difficult language is in this context. They said, "I'm really struggling in completing this section of the survey, and I'm from the community. It's likely that if the first aider is caring, respectful, and trying to get it right, their efforts will be appreciated." So when you're talking to the person, unless it's relevant to assisting them, don't ask if they are LGBTIQ. If it seems relevant and you want to ask questions, you should first ask their permission about asking questions. And then watch for subtle cues that might indicate that they're uncomfortable with the questions that you're asking. It's important when providing mental health first aid that you don't just focus on their LGBTIQ experience. And that you not ask questions that you wouldn't ask a non-LGBTIQ person. So do you think this is a phase, or asking a trans person what their quote unquote real name is. When providing mental health first aid to an LGBTIQ person, you may run into some difficulties. They may be uncomfortable talking with you or you may be uncomfortable talking with them. If this is the case, the best thing you can do is help them find someone that they are comfortable talking to. Be aware that LGBTIQ people who have been marginalized may express anger or hostility. If this is the case, try not to take it personally. And also, it can be really helpful if you ask them to tell you if you say or do something that makes them uncomfortable. And if you do that you apologize and move on rather than focusing on your mistake or what you've learned. Having said that, don't let the fear of saying the wrong thing prevent you from offering help. It's really more important that you be genuinely caring than to say all the right things. The guidelines also outline some specific things that you can do to support the person. These include respecting the person's LGBTIQ experience, because this can really go a long way to improving their sense of well-being. Asking the person what they think would help them, irrespective of the possible cause of their distress. So they might be distressed about coming out to their family, but rather than saying, oh, go talk to this service or talk to that person, start with asking them what they think might be helpful. Showing your support in a concrete way can be really helpful. So you can do this by respecting the choices the person makes about clothing, name, and pronouns, even if you don't understand it or you don't feel comfortable. And listening to the person and not feeling like you need to have all the answers or provide advice. There's also some things that you shouldn't do. You shouldn't offer your opinion on the person's LGBTIQ experience unless it's invited. Don't express judgment about the person's LGBTIQ experience when interacting with them. Don't refer to your own religious or moral beliefs about LGBTIQ experiences. Don't give the person the impression that being LGBTIQ is a deviation from the norm. And don't say things that are intended to reassure, but really are just patronizing and not helpful. So, oh, you can talk to me. Some of my best friends are gay. One of the key actions in mental health first aid is encouraging other supports. But there are a few things to consider before doing this. Some of the supports that non-LGBTIQ people use may not be appropriate for an LGBTIQ person. So for example, if the person's family of origin or friends have rejected them, you'll need to encourage the person to seek supports from other sources. Also, you shouldn't assume that the LGBTI community will be supportive of the person you're helping. Transgender or intersex people who identify as heterosexual may not feel part of either community. Similarly, a bisexual person may experience prejudice from both communities. So this is where it's just really important that you ask them, what do you think might be helpful? So most LGBTIQ people, even those who have grown up in a really supportive family, will have experienced some degree of discrimination or prejudice. If the person is experiencing mental health problems due to bullying, harassment, or discrimination related to their LGBTIQ experience, you can let them know that they can report it to authorities if it's safe to do so, and that they can pursue their rights. You should tell them about available services. So this might be an LGBTIQ advocacy or legal service. You can encourage them to seek help from a mental health professional or a support service. But most importantly, don't push them to take action, but rather support them if they choose to do so. In these guidelines, the term coming out refers to the situation where an LGBTIQ person tells others with whom they have an ongoing relationship about their sexuality, gender identity, or intersex variation for the first time. Coming out may refer to the first time a person shares their sexuality, gender identity, or intersex variation with anyone, or it could be the process by which they begin to share with others in their life. Be aware that not all transgender and intersex people will go through a coming out process. The term disclosure in the guidelines refers to the situation where an LGBTIQ person who is generally open about their sexuality, gender identity, or intersex variation tells a new person for the first time. This might include telling the first aider or a mental health professional. So we've made this distinction in the guidelines because the emotional cost of coming out may actually be greater than for disclosure. So when providing mental health first aid to someone, you need to be aware of the factors that may affect the risk of mental health problems during the coming out process. For example, the possibility of rejection, discrimination, or abuse by family, friends, employers, coworkers, etc. However, you should know that coming out may actually have a positive effect on the person's mental health and well-being. If the person has experienced negative reactions in response to their coming out, in addition to some of the basic mental health first aid skills that we teach, like listening non-judgmentally, expressing empathy, etc., you can also respect the person's feelings. So that might be about saying things, look, it's understandable that you're upset by your parents' reaction. You can tell the person that may take time for others to accept their LGBTIQ experience. It's important that you know about and inform the person of online resources that share others' experiences of coming out, and also encourage the person to contact a support service for LGBTIQ people. The guidelines also touch on a few things to do if the person is an adolescent. So I think we can all agree that adolescence is a challenging time for most people, but for an LGBTIQ person, these challenges can be amplified. For example, a gender diverse young person may experience additional stressors around age of consent to seek treatment, cost of treatment, and restrictive laws. An adolescent may be uncertain about their sexuality or gender identity, and while these may change over time, this does not invalidate their current experience. So if this is the case, you should not tell them they have to be an adult before they can know if they're LGBTIQ, nor should you pressure the adolescent to commit to a sexuality or gender identity or pressure them to come out. Now remember, these guidelines are for mental health first aiders when working. If you're working with an adolescent in a professional capacity, you need to follow your professional and workplace requirements. However, if you are working in the capacity of a first aider, you need to know that you're not obliged to tell the person's parents. You should not tell anybody about the person's LGBTIQ experience without their permission, because to do so may put the young person at risk of harm, so being kicked out of home or violence. If you have concerns for safety and you need to breach confidentiality, you only need to share the information necessary to keep them safe. So you don't need to actually share about their LGBTIQ experience. So when encouraging the person to seek professional treatment, it is important that you not assume that all LGBTIQ specific services are really appropriate for that person's specific LGBTIQ experience. An LGB service may not have a lot of experience supporting a transgender person. Help the person to find the resources specific to their LGBTIQ experience where these are available. And even if there is an LGBTIQ specific service, the person may not want to go to, may be reluctant to attend. So if this is the case, help them find an LGBTIQ friendly mainstream service. You also need to be aware of the potential barriers that limit access to professional help for LGBTIQ people. So this is actual or anticipated discrimination, for example. If the person lives in a rural area, they may face additional challenges. So this can include geographical isolation, rural culture, limited access to culturally competent mental health services, and greater exposure to discrimination. So ask the person about the barriers that are preventing them from receiving support that they need. If appropriate services are not available or they're not comfortable going to see someone face-to-face, consider recommending online resources. So this could be online information, counseling, or support groups. And finally, if the person is in a mental health crisis, know that you can enlist the help of others without sharing the person's LGBTIQ experience. Okay, so that is the guidelines in a nutshell. Again, I would really encourage you to download them and have a look at what's in them. So you can do that by going to our website, which is www.mhfa.com.au. Click on the resources tab and click on the word guidelines and scroll down. They're about halfway down the page. And then I will give you all my email if you want the references or just have anything else that you want to ask me about that we don't cover in the next section. So there's my email address again, and I just thank you so much for listening and would welcome questions. I'll have a look and see if there were any questions typed earlier. And if I missed any, feel free to retype them or direct me to them. Okay, doesn't look like there were any questions. Okay, so here's one question from Sally. Actually, Kathy, I'm curious as to if existing trainers will be trained in these guidelines. That's a good question. What we're planning on doing is doing an upskilling sort of thing where we talk about how you can incorporate the guidelines into the standard mental health first aid and the youth course. So instructors will, I'm not exactly sure how that's going to look. We're just working on that now, but they'll be presented the guidelines similar to what I did today. And then we'll talk about how they can incorporate the guidelines into their training. And then there's another question from Tommy from Auckland. Do the guidelines cover children, or is there anything in support of trans children? That's a great question. The guidelines don't cover children. When we do these guidelines, it's often such a big area that we have to draw some boundaries around it just to make it manageable. And so we left it at adults and adolescents. I don't know if Sally maybe has some advice about support of trans children, any services or support, can't think of the word, but anything that would be supportive of trans children. Sally, if you do, you can type that and I'll read it out. Most of our programs are aimed at adults helping adolescents, and then adolescents supporting their friends. We have one set of guidelines on if a child experiences a traumatic event, but that we tend to focus on adults and adolescents here at Mental Health First Aid. So I'm not sure. Sally, did you hear the question? Oh wait, here's Sally. Very good.
Hi. Yeah, that's a good question around support for trans children. Actually, I'm not too sure. It probably really depends on what's in your local area, whether there is a clinic for trans children in your local area. And I think that's probably where I'd probably direct people to. Like in Brisbane, I know we have a clinic at the Royal Children's Hospital, and in Sydney and Melbourne, I believe there's something similar. Yeah. But I really like what you're saying there, Kathy, about these are really guidelines for about adults supporting other adults, or adults supporting young people, or young people supporting their peers. so I really appreciate that for many of us, like the guidelines Kathy went through, one sense are really, for many of us, I'm sure, who are watching, very common sense, and what we probably would already know. But I'm hoping for our communities and for people who don't know much around mental health or how to support our peers, that this type of resource would be quite helpful to them, or people who don't know much around our LGBTI community, and additionally a bit more about how do we support them. Kathy, I just saw the questions popped up. Another question just popped up for you.
Yeah, so that's any tips on supporting trans young people with autism. Beyond the guidelines, I don't know, Sally, you might be able to direct people better on that. My expertise is in developing guidelines, and this was one set of guidelines that I've developed. But no, I don't have anything to add about autism and trans.
Sure. Yeah, absolutely. Actually, only a couple of months ago, we actually did a webinar around LGBT people with autism. So if you go to our Network Mind Out website, we have a recording of our previous webinars, so you can actually go back and watch that one. I can't remember if that was young people specific or just across the board, but it was actually quite an interesting webinar. And I think probably what that question in of itself really points out is actually there's lots of these intersections that LGBTI people will be people with disabilities, they'll be culturally diverse, they'll be from rural regional areas, and in one sense this guideline probably can't cover all of those intersections within this, but I also know that Mental Health First Aid has other guidelines as well, don't you, Kathy?
We do. So we have guidelines around helping someone with depression, someone who's experiencing a panic attack, who experienced traumatic event, let's see if I can remember, psychosis, eating disorders, suicide, and then we have a whole suite of guidelines addressing all of those mental health problems in an Aboriginal or Torres Strait Islander person as well. And then also some specific guidelines about helping someone with a gambling problem or of financial difficulties and mental health problems. So if you go to that guidelines page, you can see we've got quite a number of guidelines, and I think they kind of marry really well together, reading the LGBTIQ ones alongside some of the other ones. Now I have Christopher from Canberra has said that in the ACT, people can contact a gender agenda on 02-6162-1924 for support regarding young trans people.
Right.
So do you want me to say that number one more time?
If you want to say that, say that again.
It's 02-6162-1924, and the name of the organization is A Gender Agenda in the ACT.
And there's also another question there from Shay in Brisbane about how working with trans misogyny. I'm sort of actually curious, just to clarify that question, Shay, do you mean from trans people themselves or from other LGB people? Just sort of be curious about the context there. But I guess, Kathy, maybe you can reflect upon if you're providing mental health first aid to an LGBTI person, LGBTIQ person, and they themselves express some discriminatory attitudes towards other identities, what sort of, how did the guidelines support the first aiders to respond to that?
I guess first and foremost, it's about presenting yourself in a really non-judgmental way, because I think in the guidelines, if someone has mental health problems, you don't want to alienate them by correcting them or doing that sort of thing. But you can certainly gently maybe point out some things. And I think the biggest thing is maybe redirecting and getting them to talk about themselves and what's going on for them and their mental health problems. And, you know, when they're well again, if you've developed a relationship, maybe that's a good time to kind of address some of the the other issues that might pop up. But I guess if I'm talking just about the guidelines and I'm talking about someone that's acutely distressed, it may not be the best time to address that. But once they're feeling better in themselves and you've developed a good relationship with them, that might be a great time to gently talk to them about some of those attitudes, some of the things that you noticed and the things that they said.
I think that's a really, really great point, Kathy. Like, a mental health first aid is often implemented when people are in a moment of crisis, when they're experiencing distress. And in those times, they might use terminology or language that we might not deem appropriate, or that you might not use in your own world, but that might not necessarily be the right timing to address that, because the primary purpose at that moment in time is to provide that person with support, and potentially at that moment pulling them up on some language technicality might actually cause more distress than help. Yeah.
Now, there's another question from Amy from Melbourne, and it says, what happens if an LGBTI person feels their mental health service is discriminating against them? What is the best response in regards to that system? And again, I think in the moment, if I'm understanding the question correctly, in the moment, probably dealing with systematic issues may not be the way to go. It may be to focus on the person's distress. And certainly in mental health first aid generally, we often talk to people that sometimes it takes some time to find the right mental health professional. You don't always, I think, maybe you're considered lucky if you go to the first person you go to is someone that is a good fit for you. So no, maybe not lucky, but it doesn't always happen that the first person you see is the right person for you. And if they're not the right person for you, then finding another person is helpful. So if the LGBTIQ specific service isn't a good fit, then maybe looking at some LGBTIQ friendly services might be the way to go.
Yeah, I agree. I think that's a really great recommendation, Kathy. I think that sometimes when people are in distress, it might be difficult to respond to systemic discrimination. It might be just about trying to get the person the right support in that moment and trying alternative avenues. I do also know that it's really hard sometimes in some locations when there might be very few LGBTI accessible services. And I think it's really important just to remind people about Q Life, and they have an amazing database of referral across Australia for the LGBTI community. So I think if you're working with someone who's experiencing distress and they're needing additional support, utilising services like Q Life to find local in-person services can be a really great port of call. And I think certainly if someone's experiencing discrimination from their service, it's probably not helpful to recommend them to keep engaging with that service. That it's probably best that they do try and find an alternative, but not to give up on trying to find alternatives.
That's right.
Yeah. Great. Well, I think I'm not sure if there's any other questions, but thank you so much, Kathy, for doing today's presentation. I really encourage people to go check out the guidelines, download them. The recording from today's webinar will be put on the Mind Out webpage. And I guess I'm really interested to see how these guidelines will be rolling out over the next period of time, and to see them sort of infiltrate the mental health first aid community and just to see a bit more out there, which would be really exciting for our community and for the work that mental health first aid is doing. So
yeah, that's my next project, Sally, is to record this webinar for our instructors. So yeah, hopefully it will be happening soon.
Excellent. Thank you so much. And as Kathy has shared her email address, which I'm happy to share again. So please get into touch base with Kathy.
I think it's at the front slide as well. So if you go into the presentation, once it's uploaded, I think it's there as well.
Beautiful. Excellent. So download the slides, share this resource, and I think really encourage our LGBTI communities to engage in mental health first aid. And when you're engaging in mental health first aid, have a chat to instructor and let them know that these guidelines are there and that you would like them to be incorporated into the training that you're doing. So the more that we can sort of communicate to people these guidelines are out there, and the more we can use them, the more support our community will be getting.
That's right.
So, yeah. So lovely.
Great.
Thank you very much.
Thank you.
Again, we'll have another webinar next month. I haven't actually locked that one in yet, but we're having a webinar also in March that is looking at research around suicide risk for LGBT populations. But as soon as I get next month's webinar locked in, I'll be promoting that as well. So thank you everyone for joining us today. And we'll see you all next month. So thank you very much.
Thank you, Sally. Bye, everyone.